We'll move on to the next lecture. I'm delighted to present to you a distinguished professional with an impressive 2-decade-long journey in the field of anatomical pathology. Please welcome Ms. Anuradha Dihingia, the manager, parenting and AI at Roche Diagnostics, supporting India and SR1 countries. Anuradha's expertise spans a range of advanced applications, including Ventana benchmark instrument, FDA-approved assays, digital pathology, and multiplexing assays. Ms. Anuradha holds a Bachelor of Science degree in Life Sciences and has further honed her skills through the Advanced Histopathology and Cytology technical training course at Tata Memorial Hospital in Mumbai. Her extensive background and specialized knowledge make her a valuable asset in the evolving landscape of diagnostic technologies. She will be discussing on digital pathology. Ms. Anuradha, the audience is now yours.
Good evening, everyone. You are able to see my screen?
Yes.
Yes, ma'am.
Yes. Good evening, everyone, once again. Thank you for giving me this opportunity to be a part of your prestigious event, for this virtual event. Today evening, I would be discussing about the digital pathology and what AI algorithm is bringing up the piece in the histopathology segment and into the cytopathology area. Coming down to the slide, what is, 1 minute, just hold on. So what is digital pathology all around and what is the buzz going on it? So basically the digital pathology technology, it encompasses around the scanning of instrument, high-speed scanning of instrument. What does the instrument does? It digitizes the glass slide, and once the glass slide has been digitized, the software, it will do the case management. When I'm talking about the case management in the routine method, the glass slides have been submitted to the pathologist. And here, everything has been in a digitalized manner where the cases can be viewed, shared, and then analyzed. And this has been done by the dedicated workstation. When I'm talking about the dedicated workstation, those are the display monitor, medical grade monitor, where this task has been performed by the histotechnicians also, because histotechnicians also plays a very important role over here. Then coming down to the pathologist who does the diagnosis, and IT administrator also plays a major task. Why I'm talking about the IT administrator over here? Because nowhere they are the key pillar, to establish the digital pathology in the anatomic and surgical area. So they are the key main person who works along with the pathologists as well as with the histotechnicians to give a digital transformation in the surgical pathology. Now coming down to what this whole slide talks about and what should be the concordance. Now, if a lab or a hospital is planning to go ahead with the digital pathology, there are many things which needs to be taken into consideration, and where the guidelines talks about, the guidelines which is example College of American Pathology and Royal College of UK, they talk about the concordance ratio between the glass slide microscopy and with the whole slide imaging should be more than 95%. Now, what we are seeing in the evolving market where the digital scanners have come up, and there is also an FDA approval for the scanners as well as for the software, the overall concordance now we are seeing it is more than 97%. Now coming down to how this digital pathology, they have gained this booming, and digital pathology is there in this market for quite long, but only at the pandemic time, it has gained its importance, where everything was completely shut down, and very few people were traveling, like technicians, pathologists, very few were traveling to hospital, and rest were working virtually. And that's how, the digital pathology has changed the market. And initially, like 25% of the, across the globe were having the scanners. And now you would see after 2019 onwards, you are seeing the shift, like there's a 12% increase shift in the digital scanners. Now, many of this, there were initially very few players in the digital pathology market, especially with the scanners. And now, if you can see, there are many local players also coming into this field. Now, when I'm talking about the local field, there are like local partners, taking a help from the engineering institution, and they are making this such kind of small scanners where you can see in the like bigger multinational companies like Leica, Roche, who are already there in this market for quite long. So there are many players coming, and then what we can see is like there are many digital usage also has increased by more than 7 times. And along with the digital scanners, now we could see the algorithms, which is that is artificial intelligence, which is also coming into the picture. And especially they are used by the pathologists, like especially to report the predictive markers where the quantification is required. I'll be talking those things into my next slide. Coming down to when you're thinking of establishment of digital pathology workflow, there is lot many transformation which happens in the histopathology lab work area. Now we look at the histopathology lab, there are many manual processes are involved, and in those manual process where we are not seeing, those things have been barcoded, neither they have been LIS integration. But now many hospitals and lab where they are approaching for digital pathology, the first thing now they realize after buying the scanners, there is a lack somewhere in the LIS integration piece. And now with that LIS integration piece coming into the picture, there are the histopathology workflow is also getting, digitalized. When I'm talking about the histopathology workflow getting digitalized, there are sample tracking system which are available in the histopathology area, which is now gaining the market with the help of the digital scanner. When I'm talking about the sample tracking, which is involved with the digital pathology workflow, what it exactly does is like from your sample receiving to your submission of the report, so it will be tracking the complete system, and where like every specimen, every block which has been prepared, it would be barcoded and the tracking would happen. And what is the benefit of it? Like with of it is like with the when we are doing the tracking, the chain of custody is there. It means the right sample and right preparation of slide is been handed over to the pathologist, and the right diagnosis is going to the patient. And along with the digital pathology, it helps the pathologist, even they can work from home if they are not available in the hospital campus, they can remotely access via laptop or via mobile, and it becomes very easy for them to do this part. And in this process, many of the manual things, like where the register has been maintained, to where the data has to be mentioned of the specimen entry to your submission of the slides to the pathologist and to the archivings. So everything now, if you can see, there are many things which has been evolving, and there the digitalization is also happening in the histopathology work area. Now coming down to what is the advancing in the pathology work area, when you see and what is the benefit when we are going into the complete digitalization in the workflow as well as in the digital scanner area. What you can see over here, the main one driver which is happening over here is the healthcare cost, which is inefficiency. Now, how the digitization can help over here? Basically, digitization can reduce the misidentification errors and risk of loss of damage to the slides or specimen. If the specimens or the slides are not barcoded, there are some chances that we might, there are mislabeling can happen, and due to the mislabeling, misdiagnosis can happen. And with the digitalization, this errors can be reduced. And now, what is the benefit when we go for the digitalization of with the scanners? There you would be finding, the good part about is like the cases doesn't need to go out. The patient doesn't need to carry those slides to any of the international firms or hospitals. Those images can be immediately transferred by a second opinion with the help of the scanners. Because when I'm talking about when the glass slide has been courier to a different hospital setup, or maybe which is not there in Colombo, maybe it is there in somewhere else, and you want to take an opinion of that particular case. So the digital glass slide images can be immediately transferred to that particular hospital or institution if you are collaborated with, say, US or Europe. Those cases can be digitalized, transferred, and we can give them the access to those pathologists over there, say 1 day or say 2 weeks, if you whichever amount of time you want to keep it, and they can see the cases, and they can report these cases out, and they can share that opinion with you. So that in this way, the 10 to 12% of there is a increase in the there is a requirement for the second opinion. And what digital pathology has done in the histopathology work area, because there are not many pre-analytics, which has been required to make the preparation of the slides for digital scanner. So when there is a, you could see lot of improvement which happens in the lab work area. And what we have in the recent papers where it has been published, they have seen like the workload has also been increased, and top of it, the efficiency also of the pathology work has gone up by 13%. Now, coming down to the digital pathology, if you look at the pathologist perspective point, how it is helping them in their everyday task. Now, in the everyday task, it is helping the pathologists, they can work remotely also, where they can do their primary diagnosis. When I'm talking about looking at the primary diagnosis digitally, they are looking at the slides on their computer monitor, where they can take care of their margins, tumor size, measurements, all can be done on the digital scanner platform. Then they can also avoid the mix up of cases and anything which needs to be urgently reported. Even they are suppose not in the campus, not in the laboratory campus, but if they are into some of the meeting rooms, and if there is urgency which is required, example for the frozen section, and if the pathologist is not there in the lab, he can still report out those cases. So that is one of the added beauty of having a digital scanner in the laboratory. Now, coming down to the integration of data into the standardized pathology report. Now, with the whatever the routine report is there, if you're going with the ahead with the digital pathology scanner, then you can also integrate it, because there is some report template which come out of the from the software, and that software you can merge it with your Alliance integration, where those two reports can be combined, and whatever, suppose the AI algorithm score which you have taken for, suppose example, ER, PR, HER2, which is used in the breast cancer profile, where the quantification needs to be given. Those also can be added and integrated seamlessly with your LIMS report, HIS report. Same thing, it allows you to collaborate on the difficult cases for interpretation. When I'm talking about difficult case interpretation, sometimes you require a peer review from your seniors also. And those peer review, if it is not, you can transfer those cases digitally in a fraction of a second. And then that the pathologist can, whomever you're sharing those cases, they can discuss those cases, because the cases has been shared digitally to them, and those difficult cases can be reported out. Seamlessly, it can be used for the education and training part. Now, with my experience, where we have installed in my country the digital scanners also in the medical college, and what we have noticed is, like, those digital scanners, apart from education, they are also using it for the educational for the examination purpose. Now, in examination purpose, like they used to place multiple microscopes, to look at the slide and where spot for the spot this thing, looking at the spot cases. Now, in those thing, medical colleges, what they are using the digital display monitor which is kept in the lab, and where, like, the mass population is looking at those cases, and they are doing the examination has been conducted. Then also that is used in the training part. And when I'm talking about the training, the difficult challenges, cases, and all those things, these are can you they can be they can be shared with the students also. The pathologists can share with the students also all those cases, where uh, where you required to train them virtually. So that is also possible. Then coming down to interpretation of standard and complex IHC and ISH. Now, when I'm talking about the interpretations of the complex cases, that's where the algorithms helps out. Because manually, when you look at even at the digital images, especially example like PDL1 cases. Now, your PDL1 cases, which is used for the non-small cell lung carcinoma, where the cutoff percentage becomes very important. And when you're doing eyeballing, under the microscope or under the display monitor, and you don't have, the algorithms with you. So the 49% cutoff and 50% cutoff plays a very important role over here, because 49% cutoff would not get benefit by the targeted drug, but the 50% cutoff patient would get benefited by the targeted drug. That's where the AI tools come into the picture and helps out. Now, when you talk about the pathologist's increase in efficiency, where, as I've mentioned, the cases can be accessed anywhere, anytime. Urgency of the cases also can be handled. Now, coming down to the allocation of the cases. Now, many a times, like it happens, if a pathologist is not available, and if pathologist is going on a sudden leave, and those cases also can be, transferred to another pathologist on a fraction of a within a fraction of a time. So allocations of cases can be also be done by the senior histotechnologists, or it can be done by the pathologists also, because HOD would be able to, has the access to, if the multi-speciality pathologist is not available, then they can transfer to the cases to the available pathologist. Now, when I'm mentioning over here slides kept together as cases. Now, many a time when a pathologist look a case under the microscope, they are looking at the HNE, and if there are specialized stains or specialized antibody which has been run on those things, and you want to see those slides together, it is only possible. And under the microscope, they're toggling between one slide to the second slide, and then followed by the third, fourth slide. But in digitally, when you're looking at, you can look at HNE slides and other IHC or the special stain markers. So 6 slides or 8 slides can be looked at the same time. Now coming down to the rapid diagnostics for patient in remote location. So which I've already mentioned to you, because frozen section plays a very important role. If a pathologist is sitting at a remote location, and they don't have a senior pathologist, and senior pathologist sitting at Colombo, and they require an opinion, so frozen section slide can be scanned digitally. It can be scanned, and immediately those cases can be assigned to the pathologist who is sitting at the Colombo area. So this how it in rapid diagnosis it helps for the patient. Patient doesn't have to move, neither the slides need to be courier. And simultaneously, it helps for the multiple viewing of slides. Now, when I'm talking about how this, digital pathology, it crosses the limit of conventional microscope. This is how the digital slide looks. A case will look for the pathologist on the pathologist screen. Usually, the tray has been given to the tray is given to the pathologist, wooden tray or aluminum tray, where they have the HNE slides combined with your, IHC and special stain slides. When the pathologist looks under the digital pathology scanner, they will be getting a complete set of cases where, cases, and it will also have the grossing images. Apart from grossing images, the clinical details of the patient would also be available when they are accessing the cases by the digital scanner. That is a benefit. You don't require anything, the paper which we usually with the case paper which we give it with the slides. If the pathologist is working remotely with the digital scanner, they can view those cases with all the clinical details of the patient. Now, coming down to the how the images looks, so when I was talking about the toggling of the images, now with there are many software which has come up, and with that you can see 6 slides at a time together. Now what happens when you're looking at an HNE slides, and there are, suppose example like breast profile markers, which on breast profile markers where they have run ER, PR, HER2, Ki67, and HER2 dual ISH. So when you need to look at that one particular area, if you look at the HNE slide which is there is an ROI, region of interest, which has been marked. And if that is the area of interest, and that area, if you want to see it in your other, other slides which has like the specialized staining which has been done, the same area can be focused. So it becomes very easy for the pathologist, to look at the slide and do the reporting. Coming down to how it enable collaboration, as I have mentioned, like, for the second opinion, whichever cases, difficult cases which requires, you can share it with any of the institution where you have collaborated with any of the Western countries. Apart from that, like when I'm talking about the collaboration, you can also run your own digital EQUAS program. In India, what we are doing is we are running this digital EQUAS program. It has been run by the Tata Memorial Hospital, where more than 300 hospitals are participating. And what they are doing is, in this EQUAS program, is like initially they used to courier the slides to all these participants who are doing who are running. And in this way, like when they used to courier that time, it used to take longer time, and top of it, like the slide also used to break. Now with the because they had gone ahead with the digital scanner, and I think from the last 5 years they are doing this they are running this digital EQUAS program, and where they have increased the number of participants also. And with the program which they used to do earlier, it used to take somewhere around 2 to 3 months of the cycles to complete one batch of cycle of digital EQUAS program. Now in a year, with the digital EQUAS program, they are able to run more than 7 cycles in a year. Now, when they are running this digital EQUAS program, they are doing it for the HNE slides. They are also doing it for the advanced staining for lymphomas, and also for the breast profile and the soft tissue tumors. So that way, like digital scanners, like if you're thinking of going ahead in your country, this can also add a lot of value. You can start your own EQUAS program where the efficiency of your, different laboratories, can be taken into control, where you can share your best practices, best practices even for your pre-analytical of HNE staining, as well as for your IHC stainings. So that is one added benefit, like what we are running with the digital EQUAS program. The participants are getting benefited, so they are streamlining their process, in the histopathology work area, and also in the immunohistochemistry work area. Coming down to the education, which I've already mentioned, that medical students and the residents, they gain a lot of value by this whole slide imaging. They can go ahead with their whatever research project they want to do with it is possible. And top of it, like for the pathologist, it helps for your complex scoring of algorithm. When I'm talking about the complex scoring of algorithms, there are now many assays which are coming, and which has, like, which have been linked to the targeted drugs. When I'm talking about this targeted drugs, so they need to be scored, and this complex cases, you can compile and keep it, and you can share it with your medical students. They would, it would be beneficial when you're teaching those cases, and when you're sharing those cases about the complex cases, how to be reported out. Because when you're digitally storing, those can be kept for a longer time, and it can be, kept as a tool for the medical students to use it. Now, coming down to the algorithm piece, there are many algorithms. Initially, in the market, there were algorithms which were available for only for the breast profile markers. When I'm talking about the breast profile markers, it is only on the ER, PR, HER2, Ki67. Now with the algorithms, there are many AI companies in the market now who has developed it for PDL1, say 22C3. We do have a PDL1 for SP263, that is for the non-small cell lung carcinoma. And apart from that, there are many AI tools which are now coming, for your HNE slides also. When I'm talking about HNE slides, the AI tools, they can talk about the grading, as well as in the lymph node they will say the lymph node is positive or not positive. So for metastatic cases it do help out. And now when I'm talking about the digital assist algorithms, now if you have noticed that now in situ hybridization for HER2, which has been available with the Ventana platform, and in that Ventana platform, like we have come up with the algorithms also, which has been launched in 2022, and with this algorithm, what it is helping out, especially for the heterogeneous cases, it helps out with the heat map which is available. So you can focus in those areas, and it will help out the pathologist. Okay, this is the area where we need to look into and talk and score it. Same thing, now there are many advancement which is happening in the piece of algorithms, algorithms development. Initially, we were doing algorithm score for one single markers. Now, going forward, you will be seeing into the multiplex IHCs assay. When I'm talking about multiplex IHC assays, it means like, the IHC staining has been done more than two markers. When I'm talking more than two markers, then it means like they have been done on six markers or 8 markers or 12 markers. Staining has been done on the same slide. Antibodies have those 12 antibodies has been run on those slides, and and in future, very soon we'll be seeing those kind of features available. So multiplex algorithms are also in the future pipelines, which will be, many companies, AI companies are also developing. Now, there are now image analysis, what I was talking about, ER, HER2, HER2 detection, Ki-67. Now, if you look at, there are in the market, this FDA approved assays. Now, this FDA approved assays, now what algorithms Roche is having, the Roche is also having those algorithms. And we do have the CE-IVD approved algorithms. Now, when the assay has been FDA approved, and when you're planning to buy a scanner, and when you're planning to buy a algorithm piece also, you should look into the consideration that you're buying at least the CE-IVD approved algorithms. Because when you're going ahead with the CE-IVD approved algorithms, you need to go under a validation process. And in validation process, the pathologist needs to be confident whatever they are reporting, they are reporting with confidence with the IVD approved algorithms. Because in the market, you will also find algorithms, which are research use basis. And in research use based, there would be a validation process, which a CAP also talks about. CAP guidelines also talks about the procedure, what you need to do it, So there you have to do a stringent validation process if you're going ahead with the research use algorithm. So in the market, you will find this combination of CE-IVD approved algorithms and RU-based algorithms. So you look into consideration when you're, going ahead with the scanners as well as for the algorithm piece. Now, what I would recommend, like over here, is whenever a lab is planning to go ahead with the digital pathology, many a times, they go ahead with the algorithm piece at the same time when they're buying the scanner. But usually, what happens is algorithm piece, they come with a license. You need to take into the consideration they come with a cost. So when you're going ahead with the scanner, they require a stringent validation process. Once your validation process has been completed for your digital pathology, and you're comfortable, your pathologists, your technical staff are comfortable using the digital scanners, after that, I would suggest that you should go with the AI piece, algorithm piece for your laboratory. Coming down to when I'm talking about the algorithm over here, because there are many algorithms which are available in the market. Now, the algorithm which I'm talking about, the HER2 dual ISH, these are like, which we need to do the counting of the black signals and the red signals. Now, black signals which talk about the HER2 gene and the red signals which talk about the chromosome 17. Now, if you can look at the heat map which is available on the corner, the right-hand side corner, now you can see the various color over here. You can see the yellow color, you can see the orange color, you can see the maroonish color. Maroonish color, it becomes very easy for the pathologist. Okay, this is my highly amplified area. Okay, orange becomes your moderate amplified area, and yellow becomes your low amplified area. So when see in the frank tumor, it becomes very easy for the pathologist to report it out. But for the challenging cases, where the score is between 1.8 and 2.2, there it becomes a very challenging. The heat maps help you out where to look into it, whether to look into the orangish area or the yellow area. You can make your area of region of interest and give the score. Now, coming down to the how it improves the diagnostic and prognosis and prediction. Now, because patients they require more accurate diagnosis prognosis for the prediction, and this AI tools will help you out with that because it does the quantification and it will help the pathologist for the primary diagnosis. Now, apart from that, some pathologists who are into this drug development, the AI, they are developing their own AI tools in collaboration with any of the pharma companies. That is also possible. And also in the understanding the pathology, where there are some cases, where the reverse learning is required. And in those challenging cases, in the peer committee, those cases can be discussed and been shared, and those cases can be kept for these medical students, for the education purpose. Now, talking about the improving the accuracy. When I'm talking about the improving the accuracy, now if you look into it, now there is a HER2 low which has come into the picture. Now, where the cutoff percentage, when you're looking at when you're scoring, the HER2 low and your ultra lows, especially with your 1+, and when you're doing it, the algorithm piece over here, it would actually helps the pathologist, to focus on those areas and to give them appropriate score, appropriate score for it. So as I was talking about the HER2 dish, where the score is between 1.8, the topmost case which you are able to see, there are not many, orangish area and the maroonish area. There are many of this yellowish area. So it means that it is a low amplified case. So the heat map over here helps the pathologist, to focus on those areas, and and they can do this. They can generate the score out of it. Now, now in the market, now when you're planning to go ahead with the scanners and the algorithm piece from one particular company, they might be limited to few of these algorithms. Say maybe might be limited to the breast profile markers or the lungs, But nowadays there are many algorithms companies which are available in the market, and they can be. You need to see the whichever scanners you're planning to buy, those third party algorithms can be integrated with your scanner, whichever scanner you're planning to buy or the software you're planning to buy. They should be integrated seamlessly. Now, universally accepted format, for the digital slide is the DICOM format. So you need to see your scanner, whichever you're buying, is having this DICOM format capability. Now, always the storage is always a concern for any institution. The DICOM format images, they can be easily integrated to the PAC server. So where the radiology uses the PAC server, your digital images also, if they are into the DICOM format, they can be easily merged with those PAC server. So you have to look into the consideration, does your scanners, they do have the DICOM format facility. Coming down to the clinical decision support, see, digital pathology, if you're going ahead, planning to go ahead in your country, it does have the added value. When I'm talking about the added value, suppose if you are having a tumor board meeting, your digital images, can be shared to the clinicians, to the radiologists, via link which will be generated from the software itself, and the access can be given. And with this particular platform, either the pathologists or the clinicians, can discuss these cases out. So digital pathology do has its added benefit when it comes down to the clinical decision reporting pattern. Now, here, when I'm talking about the remote pathology, I would also like to share a story, a very short story I would share over here, because I was part of this process. So when India was going complete lockdown, and from Tata Memorial Hospital, Dr. Sangeeta Desai, who is the HOD over there, she had approached us, and they were having the digital scanner, and it was under the validation process, and we knew that lockdown is going to happen, and within 6 hours of time work of frame, because when the validation process was going, so only two residents and one of the technicians were trained on it. And because the lockdown was happening, and they had given us, call on Friday, and from Monday onwards, the complete lockdown was supposed to happen. So Friday, I think in the period of 6 hours, we trained the three most senior most pathologists, and we trained another three histotechnicians, and we made sure the one more thing is that internet connections, need to be stable, and the internet speed to be maintained. So here, when we were training the pathologists and the technician over here, our IT people were taking care of the hiccups which is going to come ahead. So in this lockdown period, like we had supported Tata Memorial Hospital, myself and my IT person, used to work round the clock. 2 months, 2.5 months, we had supported this program, and where they have, digitally signed out more than 500 cases, where the discordance was less than 4%. When I'm talking about discordance on less than 4%, it means there were few cases where they wanted to refer it back to the microscope. Now, coming down to the cost saving, yes, digital pathology delivers also on the high overall return on investment. This how an institution will take into the consideration the management. They will have to look into it, because in this one thing what we see in the return of investment, it speed up the time for diagnosis. One of the speed of the time for diagnosis is like, when you're taking the second opinion also from the other countries, your patient is not moving out, and you're taking the opinion in a faster pace, and patient is also getting benefited, and treatment is given. So one, it is speeding up the time for diagnosis and the treatment part. Then also it eliminates the courier cost. Lot many slight couriers, which is which costing has been involved in this. So those are also taken consideration. And top of it, it expedites the surgical consultation. Now, this is my last slide. Now, how will the digital pathology applications help in the patient journey? So in this, there are 3 points which I have covered. The patient come down to your hospital or to your institution. If it has been completely digitalized, the lab is completely digitalized, and it has a digital pathology available in that. First of all, there would be increase in the patient test, and also the cases would be reviewed by the expert opinion. When I'm talking about the expert opinion, It would be inside the country, outside the country also, and now when you're accessing those digital cases, now with the help of this digital pathology algorithms, basically it helps the pathologist, to give the correct diagnosis, and it helps into the decision making also. And when I'm talking about into the decision making, that is the clinical decision making, where all those discussions happens in the tumor board meetings. And with that, with the digital pathology algorithms, we can predict the patient risk of recurrence. And this can be, because if the images are digitally stored and digitally captured, so the monitoring of this patient can happen. Monitoring of the patient, you don't have to go back to the files, go back to the slides, archiving and then remove those class slides, review it and all. With the digital platform, you can have those old cases, new cases, everything compiled together, and you can track those patients if those patients are again coming back, for maybe for any recurrence or something. So with the digital pathology, it enhances the journey, the patient journey, and we know that we are with this digitalization, there is an enhancement in the histopathology lab work area also. And with this, I would end my slide. I'm open for any questions over here. Any questions for me?
Okay, thank you, Ms. Anuradha, for that interesting and informative presentation. I think with the time limitation, we have to move to the next lecture.